The date was March 13th. A national emergency was declared. States started going into lockdown, one after another. The date is now August 1st. It is now who knows how many days into quarantine for some of us. Schools are opening up soon, despite rising cases, despite pleas from our educators and healthcare officials. People are still protesting the wearing of masks, claiming the virus is a hoax. Therefore, I'm going to take the next couple of minutes to address the spread of misinformation in regards to COVID-19, specifically in a video made by Dr. Kelly Victory that has been going around. The points made by her portray common beliefs shared by anti-maskers. In my speech, I will discuss Dr. Kelly Victory's lack of credentials and point out all the flaws in the statements made by her. I will debunk her claims and explain why it is dangerous to listen to people like her and follow in her viewpoints. Let's start off with this Kelly Victory's questionable credentials and credibility. Currently, she's not even a board-certified doctor, and there's no credible source I can find to prove she ever was one. I checked using certificationmatters.org with both her nickname Kelly and her real name Colleen. Her LinkedIn bio claims that she was a part of Harvard's National Preparedness Leadership Initiative, but that's misleading. According to Harvard spokeswoman, Victory only went through a 10-day program for it. She is also not the most qualified, if at all, to discuss COVID-19. If she claims to be a trauma and emergency physician, then that means she should at least know the effects of having too many people coming in, but not enough hospital space, if she has ever worked in the emergency room. Some people will have to be denied. What happens when people need to be put on ventilators, but there are no ventilators available? What happens to the average patients in hospitals that could potentially come into contact with this surge of COVID-19 patients? COVID-19 may be an acute illness, but we have turned it into a chronic problem by not taking it seriously enough, so we need to treat it like one if we want things to go back to normal again. She claims her specialty is in disaster preparedness and management and mass casualty. She may have prepared people for situations like hurricanes, floods, and active shooters, since those occur fairly often, but how could she have prepared people for a pandemic? The last pandemic was the H1N1 flu, and before that was the H3N2 virus, which was before Victory's time, if she's only been in the specialty of hers for 2 decades, as she claims. How does she test the efficacy of her preparation methods? There is no concrete data from her on how effective she was at managing and at training for a pandemic. In fact, nowhere in her LinkedIn bio does it say that she has experience in epidemiology, nowhere on the web either. It also appears that she no longer practices medicine or is taking appointments. She claims that social distancing has never been scientifically proven, since it was merely done by a high school student for science fair. First of all, it doesn't take a rocket scientist to come to the conclusion that if someone sneezes, the person closest to them will be hit with more droplets than the person further from them. Second, what does scientifically proven actually mean? Does it mean empirical evidence? Because there have been studies done on the efficacy of social distancing. A specific one done by BMC Public Health states that it prevents the spread of the virus by about 50%. She claims that the CDC says there's no reason for healthy people to be wearing masks. While that may be true, the CDC also states that COVID-19 can be spread by people who do not have symptoms and do not know they are infected. In other words, asymptomatic people can spread COVID-19 to at-risk people. These people could be anyone. They could be our friends and family, our teachers, our grocers, our cashiers, literally anyone. There are certain at-risk people who are either obligated to go back to work, like teachers, or must go back to work to earn income, also teachers. That's why it's important for everyone to wear a mask of some kind in public settings and practice social distancing. Not everyone has the privilege of quarantining or staying at home. I speak for our educators when I say this. With schools being forced to reopen, what happens if the teacher were to contract COVID-19? Clearly, they would need at least a month off from school, both to recover from COVID-19 and to make sure they're no longer contagious before they return. Who's going to take over for them in the meantime? Subs? A majority of subs are retired teachers of old age and at high risk. Who are we to ask them to come in and take over for her class that was just exposed to the very virus that could kill them? She claims that masks can cause carbon dioxide poisoning, specifically cloth masks. That claim is 100% unfounded. According to Harvard Healthcare, cloth masks are not airtight, therefore they cannot cause carbon dioxide poisoning. In fact, they let in more air than the N95 masks used by our healthcare workers. So if they can wear a face shield and 3 more masks on top of their N95 mask, we'll be fine wearing a singular cloth one that is not only more comfortable but also lets more air in. Let's not forget to mention that if we can get oxygen into the mask, we can get carbon dioxide out. This is because those particles are too small to be effectively trapped inside a mask that was designed to trap larger particles like viral droplets. And I'm going to be wearing a mask for the remainder of the speech to prove that I can breathe through a mask. She claims that masks weaken the body's immune system. Her claim is utterly invalid because, believe it or not, we are born with a microbiome. We received it from our mothers during birth. Over the years, and by the time we're adults, we will have been exposed to enough viruses and bacteria to have formed a sufficient immune system. On top of that, most of us will have been given vaccines. Now let's get back on topic to Kelly's claim that if we keep wearing masks, our immune system won't know whether or not to keep fighting. Believe it or not, our immune system doesn't just shut off like a light switch after not being exposed to viruses and bacteria for an extended period of time. Our body keeps certain antibodies for certain diseases and remembers how to fight off that disease in the future. Therefore, her argument that we won't be exposed to new viruses and bacteria just doesn't make sense logically. We have no need for new exposure. We already have a developed immune system for when we actually need it. Her telling people to go out and about and catch COVID-19, to let their children catch COVID-19, is highly irresponsible. What about the people that don't know they're at risk? What about the children whose underlying health conditions have not yet been diagnosed? She fails to take into account that even healthy people can get COVID-19 and that they may need a ventilator to help them breathe. If everyone all of a sudden follows the mentality of herd immunity by exposing themselves to COVID-19, we would overwhelm our healthcare workers. Not only does this affect COVID-19 patients, it also affects people with other conditions and illnesses who need prolonged care in a hospital to recover. It affects people who need to have necessary medical procedures performed on them. Where will they be placed after the procedure if all the rooms are taken up by COVID-19 patients? If it can go the other way too, where would COVID-19 patients be placed if there are people who have an illness such as cancer who need the room? How will our healthcare workers determine who to prioritize? A lot of places are not accepting new patients either. Where do these people go? She compares COVID-19 to the likeness of HIV, herpes, and Ebola and how scientists have never been able to develop an effective vaccine for them. I'd like to first point out that yes, there are currently no vaccines for HIV and herpes, but not only is there a cure for Ebola, there's also a vaccine for it, multiple in fact. One of them is Ervivo. It has been clinically proven to be 100% effective in preventing Ebola. So I'm not sure where this Dr. Kelly gets her information from, but she also needs to fact-check herself and stop spreading lies. Again, we're coming back to the credibility issue of hers. Moreover, let's compare her advice of herd immunity to herpes. Like COVID-19, it is most deadly to immunocompromised people. In theory, it is good to catch either virus so we can become immune to it, right? Wrong. But with herpes, even after someone contracts it or recovers from it, they can still have flare-ups and infect others. With COVID-19, the same thing could happen. Having antibodies doesn't necessarily mean immunity. Currently, there's no evidence to support that our body will become immune to COVID-19 after we contract it. What's more, we could still infect others even after we recover from it. That's why we're waiting for a vaccine. That's the best option for developing herd immunity. Now, let's bring up the fact that Victory started and ended her video with the pandemic preventing people from worshipping. That's just not true and is a ploy to skew people's opinions and emotions in her favor. People have not been prohibited from worshipping. Church is still being offered online via sessions on Zoom and live stream through YouTube. Worshipping with our family at home is still an option. Independent worshipping is an option. Now that we've established why people like Kelly Victory offer invalid points, let's talk about who is qualified to discuss COVID-19 and give advice on it. Dr. Anthony Fauci. Not only is he a board-certified doctor in infectious diseases and immunology with a long list of awards and honors, he is also by every means more credible than Kelly Victory due to decades more experience. So please, from now on, I urge each and every one of you to fact-check the information you choose to believe in order to stay educated and knowledgeable in current events and to prevent the spread of false information in an era where fake news is rampaging.